There are a lot of follow-up services that have been developed nationally, but there are very few that have got the rehabilitation class as a key component of that. And the way that we've delivered that with a huge commitment right from the outset to having a multidisciplinary approach with physios, nurses and medical staff involved has been quite unique.
I think coming to a gym or an exercise class meant that they could see what they could actually achieve. Many of these patients have been near to death, and that weighs very heavy on their mind, and coming to something like the rehab group, they never felt that they would ever be able to do something like that again. So from a confidence point of view, that really helped.
We see people walk in on the little triangular rollators with such effort, you know, really huge effort, and by the end sometimes Sarah's got them down to one stick. But it's great to see them go down to a frame, 2 sticks, 1 stick, and sometimes they even come in and jingle their car keys because they're back to driving.
Our role really is to assess and monitor and basically look after patients with Parkinson's disease. There's 3 of us that work within our trust.
We cover geographically everywhere from Faversham down to Dungeness, taking in Tenterton and Biddenden. People that we see in clinic will have our contact details, and if they run into a problem, they can get in touch.
Many of our patients coming into hospital will have varying different health problems. Parkinson's disease very often isn't the primary reason for admission to hospital. It may be that they've fallen, it may be that they're confused or delirious, they may be having a routine operation or an emergency operation. Part of our role will be when we go to see the patient on the ward, so make sure that their normal medication is prescribed appropriately.
Speak to consultant ENT surgeons across the country and ask them what was the best or one of the best wards you've been on and why was it. They would say 1, probably Rotary at Ashford, and 2, the reason for it is the team working.
We've introduced multidisciplinary pre-assessments so that all of the disciplines see the patients pre-operatively.
Even on days, where we might be a bit down, everyone works their hardest to make that day successful, to make it better, to make it pleasant for everyone, including the patient and the staff.
Our team seem to sort of find out what the patient's like and just do that bit more.
Just doing silly little things that you would for your own family, cutting patients' hair, making special events of their birthdays, Christmas.
We recently had a wedding blessing on the ward because we knew our patient was end of life and wouldn't see his granddaughter get married. And as a team, we felt we made a difference to that family.